Yeah, hi. I'm Dr. Robert Klaassen. I'm a pediatric hematologist oncologist who works at the Children's Hospital of Eastern Ontario, and I'm the hematology lead for that hospital, and have been involved with hemoglobinopathies for more than 20 years, and was a lead in helping get newborn screening for hemoglobinopathies, so sickle cell disease and thalassemia, back in 2006, and was a founding member of the Canadian Hemoglobinopathy Association. So I've been very involved for a number of years in this exciting area. So I'm very pleased to be able to, present at the upcoming SCAGO meeting. Looking forward to it.
Throughout your experience caring for individuals living with sickle cell disease, what are some of the most important changes or advancements you've seen in sickle cell disease care?
Well, I think one of the most important, which may not seem very exciting to many people, but is the sort of routine standard use of hydroxyurea early on in children's care. When I first started taking care of patients with sickle cell disease, that was not routine. We were waiting till all the problems happened. And so we were playing catch up. But now that we're actually implementing that routinely in everybody at the age of 9 months, there's much less complications from sickle cell disease. So just taking a simple treatment and actually using it properly and at the best time was actually really instrumental in decreasing the amount of problems we're seeing in patients with sickle cell disease. So that's the first thing. And then the new treatment is a gene therapy, which is very exciting because it's shown dramatic changes in patients who were having multiple repeated pain crises prior to the gene therapy and then almost immediately afterwards stop having pain crises. So it's very dramatic. It's really as impactful as a bone marrow transplant, but the main advantage is you don't have to have a matched sibling, brother or sister to get this therapy. So you're using your own cells rather than a brother or sister's cells.
Since you will be a speaker for the plenary session at SCAGO Summit discussing the topic Hydroxyurea, Transfusion and Beyond Treatment Decisions in Sickle Cell Disease, what can you tell us about your presentation and what attendees can expect to learn from your session?
I'm going to talk about, the hydroxyurea, which, as I mentioned, is really kind of properly using this very simple drug has had a major impact for patients and families. So I'm going to spend some time reviewing that. I know a lot of people know a lot about hydroxyurea, but I don't think many patients and families understand the crucial impact it has on the disease trajectory of sickle cell disease. So I'm going to spend some time talking about that and then talk some more about transfusion therapy, because for the few patients where hydroxyurea doesn't work, that can be life-changing. I've had patients with very dramatic improvements with leg ulcers, what's hip patients who've had severe hip problems, bony problems that have gotten better, recurrent pain, obviously, have gotten better on exchange transfusions. So, and it's been very dramatic. And the patients I've put on exchange transfusions have really been very thankful for it and very excited about the treatment. And I've rarely had them wanting to go back to their previous treatment. So to me, that kind of tells you that it is very effective. And then I think what we want to do is then talk about the future, which is gene therapy, which is very exciting, very promising, but unfortunately is very expensive. So it's going to need a lot of work from the sickle cell community to advocate to the government to help fund this very important initiative. And, eventually, hopefully, more and more patients will be eligible for this. And it'll have potentially, hopefully, curative effect on patients, especially who've got challenging conditions and that the usual treatments aren't working. Gene therapy is the sort of the beacon at the end of the tunnel that will help them get through that.
I think it's important for patients, families, healthcare providers, and community members to come together at SCAGO Summit? And why do you think it's a valuable opportunity for the sickle cell community?
It's so important for patients and families to get better educated. So I think it's it's one thing when you come to clinic and then your doctor and your nurse talk to you, but I think it's important to be with other people who have the same challenges that you have and dealing with the same barriers and challenges, to get together and compare notes and also hear from people outside of your care team about what the treatment options are and the importance of the treatments. I think it's very important for patients and families to advocate for themselves. We certainly try from the healthcare perspective to let the government know how important it is to fund these newer treatments, especially gene therapy. But it's really important that patients and families with their own stories sort of advocate to their members of parliament, especially provincially, since the provinces fund this, to let them know how important it is that these very crucial and important, but unfortunately expensive treatments get funded by the government, because it's a basically short term. By putting the money in the short term to treat people who have this condition, you're avoiding multiple clinic visits and admissions to hospital down the road. So you're saving money down the road, and it's a difficult message to get across to the politicians and the funders, to get them to understand that putting this money up front will save the healthcare system down the road. So I think that's where the advocacy is crucial from SCAGO and the sickle cell community.
What is one message you would like to share with people considering attending the SCAGO Summit?
I think the message is get together with your fellow community of patients who have this condition and learn more, get more educated, and then get out there and advocate to the government to get more support.